If there was ever a good time to enter intensive care, this is not it. They are now the red zones in this war, where patients fight for their lives and medics try to save them. For the first time in the UK, our cameras were given access to a hospital treating critically ill coronavirus patients. 2 died here overnight at the Royal Bournemouth. 7 others are in this unit. 6 of them are on ventilators. An 8th was moved out this afternoon. Linda knew had feared for her life.
It's been hard. I just wanted to get through it for my children. Without this lot, I wouldn't have done it. It's been so good.
Did you ever think it would get this bad?
No. No, not in a million years.
This is the COVID ward where Linda will now be treated. It is a lonely road to recovery, where patients are kept in isolation and staff nurse as well as comfort.
There are 2 patients in here that have both tested positive for coronavirus. They've both been very ill, and Alan Hunt over there is just 62. He's been here for 8 days. How has it been?
Been long. You know, it's very easy. It's just so easy to catch, but you just can't get rid of it once you got it. And it affected both my lungs, so I think they're on the repair. But even though I'm still getting out of breath by doing anything at all.
ITU, there's 13 occupied in total.
Alan hopes to leave tomorrow. If he does, it frees up a bed for these nurses to reallocate.
I think they've got 4 sidewalls on 17, but they're all in use, couldn't pull them out.
Earlier at their handover meeting, they told me every death here takes its toll.
Unfortunately, within the last 24 hours, we've had 2 deaths.
That must be quite hard for you.
Yes, so basically all the patients that died last night, if you're probably aware, visiting and visitors are not allowed. So
So I've got 2 runners just helping out with everything. So all the staff, I've got 2 runners that are helping everybody.
There is little time for reflection in this job, though. By the afternoon, the emergency department is full. No patients can be admitted until one leaves.
This is the red zone. There is all the patients are behind closed doors. Recess is just 2 sets of double doors.
Aidan Siggers is the lead consultant here today.
We're all having to learn how to do this. No one's ever done this before, and part of the way that we manage things is by listening to what's been happening in other countries, in Italy and elsewhere, and learning the lessons that they tell us.
Are you apprehensive?
Not really, as long as I know that I'm doing the right sort of washing techniques and PPE is all right, so yeah.
So you've got a bit of eczema.
I do,
Yeah, that's washing your hands over and over, isn't it?
We followed her for a bit as she moved from patient to patient.
I have asthma, so it is scary, but we sort of have a duty to our patients, so it is the split between looking out for my own safety, but then also I'm a nurse. But it is scary, like I'd be lying if I was saying I wasn't scared.
Where are you taking this patient?
To X-ray, to the chest X-ray.
That's standard now here. All patients that come through ED have a chest X-ray.
Every member of staff in the red zone here has to treat each patient as if they have coronavirus. They don't know whether they do, but with any symptoms, they have to wear the PPE for their own safety.
Back in critical care, oxygen supply is becoming a concern. Many more patients on ventilation and low levels will need to be addressed.
No, it's something that we normally wouldn't even consider, how much oxygen we can get into the hospital, because we know that normally we don't have the number of patients requiring oxygen therapy, and it's something that we are worried about, that we may unfortunately run out of oxygen supply if we have too many patients needing us.
There are optimistic stories to tell here in Bournemouth. Linda is proof of that, and the nurses felt the need to mark it.